You all know how much we love ProCare. We talk about them all the time, pretty much in every episode we record.
Pretty much.
So we are really, really excited to announce.
They're sponsoring the podcast. Yay! Oh my goodness. I'm so excited.
Yes. And we truly believe in their product because we take them every single day. I take their 1-a-day capsule.
Yes. And I take their 1-a-day chewable. It's freaking delicious.
And not only do they have multivitamins, but they have calcium chews.
Yeah.
Delicious calcium chews. The salted caramel is to die for.
Oh, and the cinnamon roll, guys, tastes like a cinnamon roll. Oh my God.
They also have dinner mint, but our favorite
is the dark chocolate for 2 reasons. One, you can have it at nighttime for a treat or make a s'more out of it. We've done it. Freaking bomb.
How cool is that? So go now to procarenow.com and use code OSLP for 10% off.
Alrighty, now go now. What are you waiting for?
Go get your vitamins.
Yeah.
What up, guys? How are you doing? Let's hear you. This is amazing. We're in a freaking paradise. Well, thank you guys for coming and hanging out. We're going to do a show for you. And at the end, there's going to be question and answers, okay? Yeah. All right. Love you guys. Welcome back, welcome.
As you know, you are listening to our Sleep Life podcast. This is Kelly. This is Mel. And we are going to talk about binge eating and emotional eating.
Food addiction.
Yes. Which they all combine together.
Yeah, pretty much. Yeah. But I think I have all 3. So welcome.
Yeah, I'm pretty sure I have all 3. Yeah, that's why I had surgery.
Yeah, seriously. And I didn't know I had them until after surgery, so that's annoying.
Yeah.
And you know what's awesome? Is that we have a doctor today that specializes in behavioral eating.
Yeah.
So let's bring her out. Her name is Dr. Shapiro.
Let's dive in.
Yeah, I want to get on in because, like, 3 months after surgery, you guys probably, if you guys have listened to us, you guys know that I've had some breakdowns during my journey. And that guy back there, that's awesome, like, had to deal with all of it. And he was just like, what is going on with my wife right now? And I'm like, I don't know. Yep. But it was really weird to, like, not be able to eat my feelings anymore. So it's kind of crazy, and we have tons of questions for you.
Ask away.
All right.
All right.
So what is food addiction? Like, what is I know it's hard to describe.
Yes.
In all in one sentence.
Yeah.
But what's your best go at it?
This is such an interesting question because the question is, what is addiction? And can food be an addiction?
Because we do hear people say, like, food's not an addiction, you just have to eat it. So it shouldn't be a problem. Hold on. We'll just hold on.
Does that happen
all the time? All the time. Yeah, nice. It's fine. No worries.
We can keep talking.
Yeah.
Yeah.
So, yeah, I mean, and I think the field is very, very split. Can food be an addiction? Yes or no? And some people will say yes, and some people will say no. So what we really have to do is think about, yes, it's a problem. Can you hear me?
It's like a boom mic at this point.
Totally fine. And we're in, guys. That's what she said. That's pretty good.
Dang, that's my line.
I know.
All right, so what is an addiction? Can food be an addiction? So, what do you guys think?
I think it can.
I feel like it can because I'll hide it. And I feel like if I hide something, then there's a problem.
I definitely agree
it
with that.
makes me scared when I do those things. So I'm like, okay, that sounds like an addictive personality to me because I have family that do have some drug addiction and some alcohol abuse. So I've seen them like hide from people or won't talk about it. So I'm like, if I'm doing that with food, then doesn't that mean I'm a food addict too? Like,
well, so it's a problem. We know it's a problem. And the question is it an addiction? So what I thought we would do, and I printed out the list here, is let's go over the diagnostic criteria for addiction.
okay.
And let's see where food fits in. Okay?
Let's do it.
First criteria of addiction, use in hazardous situations.
emotionally. Interesting.
Mm-hmm.
Use in
So you're
hazardous.
using the substance in hazardous situations.
What does that exactly mean?
So drinking and driving.
Okay. Well, I can eat and drive, so I can
And many of us eat and drive, but the question is, do you binge eat and drive?
Oh.
I have. Yeah, I do. Yeah.
Yeah.
Right? So that can be a hazardous
Okay.
situation, right? Okay.
Yeah.
So let's put a check mark.
Yeah. So that one counts.
Yes.
Okay. Social interpersonal problems. So avoiding events,
Mm-hmm.
right?
Totally done that.
Right? We have activities to go to and we just binged and now we're not gonna go.
Yeah. Because you feel like shit.
Yeah.
Alright. So we're gonna check that one. Neglect role obligations. So work, home. Are you not doing things at work and at home due to binge eating?
I don't think I've done that.
Right? Maybe we have an example, maybe? Like, what would that look like?
Well, okay, so if someone's drinking, right, they may not be able to wake up in the morning and go to work,
Okay.
right? Or they may miss certain things with their family.
Okay.
So what do we think about with binge eating?
Yeah, because I would miss out on like doing activities because I'm in pain because I just gorged myself.
Okay.
Yeah.
So you're neglecting things that you have to do.
Yeah. Okay.
Even if it's like cleaning your house or, you know.
Okay.
right?
Oh, yeah.
Okay.
Yeah, makes sense.
All right, so we're gonna put a check.
Oh, there's a lot of checks.
Yeah.
Well, let's see, withdrawal symptoms, right? So
Oh, yeah.
when a person is addicted to drinking and drugs and they stop using it, they experience withdrawal. Does that happen with food?
Yes.
Yes.
Oh, I felt that
Sugar.
after post-op.
Yeah.
Like,
Yeah,
first
sugar
month.
was a big one.
Okay.
Carbs, like the way my body processes
Like
it all.
physical
Yeah, like
sensations.
physical, like tired, headache, just feeling achy and gross, and I feel like I went through withdrawal.
Yeah, I was
With sugar.
irritable.
Yeah.
Okay, so we'll put a check.
Maybe some sugar sweats.
Some sugar sweats.
Yes.
Is that a real thing? No.
Yeah.
I don't know. I mean, I was
Yes.
like, I felt like I was hot a lot and I was very
Yeah.
sweaty for the first month.
It's because the bariatric freeze hadn't kicked in.
Oh, the Bariatric freeze didn't affect me, I think, until like year 2. Really? Yeah, and then ever since I've been pissed about it.
All right.
All
what's
right.
the next one?
Tolerance. So when someone develops alcohol or drug problems, they need more and more of the substance to get the effect. Does that happen with binge eating?
Yes.
100%.
Yeah.
Yeah, because that's how like my Hershey's with Almonds went from a regular bar to a king size bar. And then even when I was pregnant with my son, y'all, I was having a giant one every other day.
And you know what, I think I actually mixed up. The next criteria is use of larger amounts and for longer durations, so they can be similar.
Okay.
Tolerance is more like you need more of it to feel the same effect.
I think
Yeah.
you do, yeah.
Yeah.
I agree with both of those.
Okay.
The longer duration, although when I would binge, it would be like as fast as I possibly could.
Well, that's one of the criteria. for
Yeah.
binge.
Oh, well, there you go.
Eating rapid.
Yeah.
Yeah.
Okay, so we're checking that one too.
Yep.
Use of larger amounts. Okay. Repeated attempts to cut down.
I'm a
Oh,
diet
100%, yeah.
Diet all the time.
No break,
That's it.
right? Okay.
Diet every Monday. Yeah.
Okay.
Trying
Oh,
to.
did you say every Monday?
Mm-hmm.
New week, new you.
That's right. New year, new you, like
After
year,
Thanksgiving.
all the things.
Yep.
Yeah.
After Christmas. Monday
Time,
never comes.
time spent in use or recovery.
So that would kind of go along with diets and stuff like that, right? Or would that be like Weight Watchers, like where you're going to like a
It could
group.
be, yeah, it could be Weight Watchers where you're going to a group, it could be therapy,
Okay.
it could be doctor's appointments, but also time spent in use. So how much time in a week are you spending thinking about food?
There is no time.
Going out and getting the food,
There's
eating the food,
Yes.
and then feeling the way you feel physically and psychologically after you eat food.
So with that being said, how, I know this whole gender thing too, like women are normally the ones that prepare meals and prep and do all those things. So how do we, like, because we have to think about those things too, like it's on our mind 24/7, like I need to make my kids meal, like for school, I need to make sure dinner's ready, I need to make sure it's out, like it is an obsessive thing because we have to be preparing for our families.
I think that is such a great question. And one of the one of the tools that we want to teach people is it is important to plan, right? Because if you plan, you think about it, it's almost like you're thinking about it in a bubble.
Okay.
You're thinking about it, and then you're done thinking about it, because it's all part of the plan.
Okay.
If there's no plan, you'll be thinking about it all day. Oh,
Yes.
lunchtime is now, what do I want to eat? Where should I go? You know, and then you're thinking and ruminating, and you know, then you get something, then you feel guilty about getting it, and that's more thought, you know?
Okay.
So planning is good, obsession is where there's a problem.
Okay.
Every second of every day you're thinking about it. Okay. Yeah, I would.
So people that don't have binge eating disorder or emotional eating or whatever we're gonna call it, they still spend time thinking about food.
Just not in the same way.
Yeah.
Okay.
Got it.
Yep.
Yeah.
So we're gonna check that one.
Yes. Yes, definitely.
Physical and psychological problems. So someone who's drinking and uses drugs has physical and psychological problems that go along with that. What about binge eating?
Mm-hmm.
Yeah.
Mm-hmm. Yeah, and psychological, definitely.
Okay. So we're gonna check that one.
No, yeah, because we obsess and like the real happens. Like even at nighttime, like I don't know about anybody else, but like when you're like laying in bed and like trying to go to sleep, like you're just kind of go through like, oh my goodness, I've had that today, I've had this today, is that bad? Wait. And then you start thinking like some of it's good and some of it's bad and you're still thinking about it an hour into you trying to go to sleep. So it's like definitely a psychological thing.
Well, yeah, it's a constant like, oh, I could get up and get that.
Mm-hmm.
Oh, what about that? No, you don't need anything, so go back to sleep. Yeah.
Yeah.
Right.
Yeah, because
It's
middle of the
like
night is
angel
for me.
funnel in your head. No?
Yep.
Yeah.
Yeah, you don't need it, but it sounds fun.
But I've noticed that if I have protein throughout the day, that reel kind of is a lot less.
It is a lot less.
And if I don't have a high stress day, that reel's a lot less as well.
Yeah. If I'm alone, that reel is constant.
It's loud.
It's very loud.
Yes.
I would agree with that. Yes.
Yeah.
You guys are really talking about a lot of the things that we do in treatment for binge eating.
Okay.
So when someone doesn't eat regularly during the day,
Mm-hmm.
and they don't get enough food in during the day, they're physically hungry. So of course you're gonna want easier food to get by the end of the day, and your eyes are gonna say, I need more and more and more and more, and you're gonna eat more.
Right.
So that is the physical part of it, and then the psychological part as well. Because if you're stressed and you're having a difficult day, then you're gonna go on to have binge if that's the way that you cope.
Mm-hmm.
Now, if you put those two things together, you're physically hungry and you had a stressful day,
Mm-hmm.
I mean,
You're just
now you're
screwed.
doubling the chances. Yeah.
Oh, that's scary business. Well, I mean, we've all been there though.
Yeah. Most of my days this year have been like that.
You're like, out of 365, it's been 300.
Yes, exactly. Yeah.
The first 5 days.
The first 6 months of the year, it was
Yeah.
pretty stressful. And then when you live alone, it's easier to binge and have a food addiction because literally nobody can see you.
Mhm.
And so you just do what you want, and then you're like, oh, I'll deal with it tomorrow. I'll deal with it tomorrow. But again, tomorrow never comes.
Yeah.
Monday never comes.
Okay, so check that one. All right, giving up important activities. That was very similar to the social and interpersonal
Yeah.
stuff.
Well, I was thinking like maybe you've gained so much weight that like you can't, like you've binged so much and you've gained weight so you can't join activities anymore. So like maybe it's hard for you to bowl or to play volleyball or play softball, something like that.
So
that.
physically giving up activities and then also maybe not wanting to go.
Mm-hmm. Yeah, yeah, I think it applies to it.
Okay? And then the last one is cravings.
Oh,
Yeah.
I don't think we even need to discuss that one.
No, that's
that is automatic, yes.
Okay, so in the field, when we talk about these criteria for addiction, and you were to ask someone, can eating be an addiction? The field is very split on that.
Mhm.
And they would say a lot of these criteria are not the same for eating as for other addictions. But yet, when we're talking about here,
Which is perfect.
the experts, right? I mean, you guys are the real experts.
Yeah, we were going through it.
Yeah.
We said every single criteria is met.
Yeah.
So the stigma is so great that they can't even admit that food's an addiction.
Well, so here's the thing, is that, is it an addiction? So
I feel like it is.
behaviorally, there's an addiction.
Okay.
Is it a food addiction? Is it an eating addiction?
I didn't know there was two different.
Well, it's just a question.
Oh.
Because is there one specific food that we're addicted to?
No,
we
I
have
think
to
it's
eat.
eating.
We
It's
have
eating.
to eat.
I think it's the sensation of eating and then like how I feel while I'm eating. And then maybe the 20 minutes after I'm eating. Then after that it hurts. So. if I'm doing the thing, if I'm doing something that like physically is gonna hurt me, yeah.
Because it's not necessarily food in general, it's about eating. If your binge food isn't in the house, some people will go out and get it, but other people will binge on whatever is there.
That's me. I will binge on whatever's there.
So it doesn't matter.
It really doesn't matter. That's why I'm saying, for me, it's an eating addiction. It doesn't matter what is there. It's the emotion of being lonely or stressed or whatever it is that I'm reaching for food.
Right.
Because for whatever reason, that brings me comfort.
Right. And there are certain parts in our brain that eating does that is very similar to addiction. The part of your brain that gets that reward sensation.
That's like the serotonin levels, right?
Right. But it's not a substance. Right? If that were the case, we would be addicted to sugar maybe or something, and we would literally be like breaking packets of sugar and eating it, right? I mean, which some people do.
I would say I've seen people do it.
Yeah, people do it.
Yeah.
But you'll still binge on another type of food if that wasn't available.
Gotcha. Okay.
Right.
So it's not a substance, it's a behavior addiction.
I mean, we can't figure out one particular food that people are addicted to.
So, yeah. So I would say a behavior
It's a behavior,
addiction.
right. Well, same thing like gambling. That's
Yeah.
a behavioral addiction.
Gambling or like a sex addiction.
Yeah, sex addiction.
So there are both behaviors. So it's funny to me that they can say that gambling is an addiction, sex is an addiction,
Right.
but eating is not an addiction.
Yeah, and I don't understand that one either, but we do need food to live.
That's what makes it so freaking hard.
Absolutely.
Because it's everywhere. Like, I remember being on my pre-op diet and I had to stop watching TV. Like, I had to go to Netflix and Hulu and stuff because I couldn't watch any more food commercials.
Yeah.
I couldn't watch like Arby's, McDonald's, Dairy Queen, all of these commercials that were going through, and I'm like, I'm sitting here with my protein shake, yay! And that was before I discovered good protein. So,
well, in advertising, like the color red makes you hungry. Like they've learned that trick.
yes,
That's why you see Arby's, McDonald's, like anything that has red is the thing for your brain.
Yeah, they all have red.
Yeah.
Interesting.
Right. And the other part of it is when we treat alcohol addiction or drug addiction, the treatment is abstinence. Right?
You
Someone who's
give it up.
heavily addicted, we can't say, just try to go out socially, every once in a while. No, it's abstinence. And how do you do that with eating?
You don't.
You don't.
Can't.
But one of the things that I like to think about is we can't not eat, but we can learn to not eat as a coping mechanism.
And that's where you come in.
Yes. I'm like, that just made me think.
Yeah.
How do we do that?
Yeah, I mean, it's ways to think about how you can, if you're planning your food, you're planning your meals, you know when you're gonna eat, you know what you're gonna eat. Sometimes these plans change, right? Friend calls out, wants to go out to dinner, these things happen. But when you know you're eating and you're not hungry, and it's not a context in which people are eating. Sometimes we're going out to lunch, we're not super hungry, but it's our lunch plan, that's appropriate.
Okay.
Right?
Okay.
But if it's the middle of the afternoon and you're home alone and you're not hungry but you're bored, that's an emotional reason. Right?
Well, and that's where I think we've heard of it. It's called HALT.
Hungry, angry, lonely, tired?
Yes.
Yep.
Yes.
If you are any of those things, like you're supposed to check in with yourself and say, halt, okay, am I really hungry? Or am I angry? Am I lonely? Or am I tired?
Right.
And tired and bored, I think, go together.
Yeah. I mean, it could be stress. It could be lots of different things. So you can just use that as a halt, like a reminder to halt.
Just remember,
and then,
am I hungry? Am I really? Because it's really hard to figure out, post-op, if we're hungry, because we don't have that hormone anymore.
Yeah, the adrenaline's gone.
Yeah.
Yeah.
So we're not feeling those hunger pains. So we're trying to basically figure it out from scratch.
So here's a question as post-op patients.
Okay.
If you were hungry and there was a piece of, if you're able to eat grilled chicken, I don't know, I'm just thinking of type of food.
Yeah.
Would you eat it if you were hungry?
Yeah.
Yeah.
Okay. So maybe that could be the test. If you have a piece of grilled chicken in the fridge, if you always keep something hands-on that is appropriate, that is approved, and if you're hungry, you say, okay, I'm gonna try this. And if you're like, no, that might be a sign that you're not hungry.
No.
Yeah.
Yeah, just like, I have my Flex Pro meals in the freezer.
I have them too.
And I'll be like, oh, I can have that, you know, in the morning or whatever, thinking I'm gonna do that. And then like I'll still have lunch, and then maybe I'm like,
That doesn't sound good.
That doesn't sound good.
I want to have some peanut butter instead.
Yeah.
Or just like leave, like go get that item.
Yeah.
Because like I want my sandwich. Sometimes I'm like, I want that bread.
See, my problem is I get so busy during the day that I forget to eat.
That's the first step.
Yeah, I forget to eat, and then I'm like ravenous by the time I'm like wherever I'm at, and then I'm like I want to eat anything and everything.
That's normal.
Yeah.
Right?
Because I'm not getting any like protein during the day. I'll get my protein shake in the morning, but the hours of like 9 to 4, I'm not eating anything.
You're starving.
Yeah.
So question for you, Kel.
Yeah.
So you're post-op.
Yeah. No.
You know, you're 2
No.
years out.
Yes. Yes.
Okay. So like we know we have to eat. We know we have to eat within a few hours of waking up.
Yes.
So what the hell's making you not eat? I love you.
That's okay. I love you too. Ass face. I don't know. I think I just get, I'm an ooh shiny person. So like, if I see something out of the corner of my eye or I think of something that I need to do, like I'm off doing that and then I'll bounce. Like there's this perfect example of how I clean my house. So I'll start at the sink and I'll be doing dishes, but then I see laundry on the table. So then I'll take the laundry to the bedroom without finishing the dishes. And then I will put the laundry on the bed and I'm like, okay, well I need to fold the laundry, but or hang up the laundry. So then I need to go and get hangers. So then I go get hangers. But then I see something else out of the corner of my eye and then I'll go to the office and then I'm like, oh, I have to post that. So then I will do that. And then I end up back at my sink eventually.
So your eating is the lowest thing on the
Oh yeah,
priority.
everything else is more important than eating.
So we need to think about what that ends up doing later in the day.
It ends up screwing me.
No.
Because I need to eat. I know I need to. And I have stuff on hand. That's the stupid thing, is I have my nuts, I have cheese, I have salami, I have Flex Pro meals, I have protein shakes, I have everything on hand. But I choose to do all the other things that are on
So
my
one of
list.
the things I like to tell my patients is to talk to yourself sometimes the way you would talk to nurturing, comforting, and setting limits.
Okay.
So if your kid had to sit down and eat lunch or dinner, but they're playing with this and playing with that and doing this and doing that, and you're just gonna let them go all day.
I'm basically a child.
No, we all have a child. We all do.
It's fun.
But we let ourselves get away with these.
We do.
Right?
We
And so
definitely
can
do.
you be kind to yourself and say, okay, I know you want to put this stuff away. I know that I'm feeling anxious because all this stuff is out. But first I need to sit down and eat something.
If you eat, then you can get up and you can do the rest of the things.
Yeah. Well, it's like us being on the airplane, the whole like, put your mask on first before you can help anybody else. Like that's what we need to do to ourselves.
Didn't I say that first?
Yeah. That's why I'm pointing it out to you, because like, you need to take care of yourself.
I do.
Yeah.
Well, I mean, we all have to take care of ourselves because at the end of the day, we only have ourselves.
Yeah.
And so we have to take care of ourselves. So I will start putting myself first. And treating myself like a child.
Yeah.
And talking to myself.
But be nice to yourself.
Yes.
Yeah.
Giving
Right.
myself grace but saying, okay, it's time to eat. You need to take a break. Eat, and then you can come back to whatever you're doing.
Exactly. And in a similar example, I have patients that will say, well, I don't deserve to eat, I'm overweight, I need to lose weight, things like that. I shouldn't be eating. And the same example, if it was a child, would you say, you know what, you're not eating till dinner?
No, that's not nice.
They still need to eat.
Yes. We have to eat. It's how we live.
Well, and you yell at me. Like, when I work at your house on Thursdays, you're like, Melanie, just stop what you're doing. You have to eat. And I'm like, oh, I just want to finish this case, one more case. And you're
I'm
like,
really good at
no.
telling other people what to do.
Well, you're good at nurturing everyone else around you.
Except for myself.
Except for yourself.
Yeah.
So.
That point that you just said of I don't deserve to eat when I'm overweight, like I feel like that is very poignant to me. Like
Okay.
I feel like that's how I felt beforehand, like before surgery. I felt like you're overweight, you're sick, like you don't deserve these things. So you need to like eat boiled chicken. Which we all know like there's healthier ways to eat.
Oh, 100%.
And better ways.
Yes.
Put some seasoning on it at least. So.
That's a nice dry rub.
But so that point makes a lot of sense to me, and it speaks to me.
Yeah.
Of like, I think because this year I gained some weight. I went through a traumatic divorce. My world has flipped upside down, and so I think somewhere in my mind I'm saying you've gained some weight. You don't need to be eating, without consciously saying it to myself.
Right. So you're punishing yourself.
Mm-hmm.
You need to punish yourself, girl. You're awesome. What are you doing?
And
But my
you
brain
wouldn't say-
doesn't know that.
And you wouldn't say that to a kid. You don't
I would
say
never
that.
say that to anybody
And
else.
I don't know if you still are in touch with your dietitian. But if you ask your dietitian, hey, listen, I've gained some weight this year. So what do you think about not eating all day and just having dinner? What do you think she would say?
Oh, she would kick my ass.
Ellen would.
She was so mad at me.
Yeah.
I mean, she yelled at me to eat a damn potato. So.
Yeah.
Oh, man.
Well, let's call Ellen when we get
Ah,
back.
shit.
When we get back to speak
I'll
home.
just play this podcast for her.
I know.
Yes, I'm gonna be like, Ellen, I need you to listen to this. This is how I've been doing for the last year.
So if you notice that, like, hey, I'm checking all these boxes, like, what the hell should we do? Because even after, like, weight loss surgery, like, we don't want to end up where we were before. Like, that is, like, the biggest fear I know.
That's number one fear for me.
So, like, how do we prevent this? Like, what can we do?
Well, I think you have to start to recognize it first.
Okay.
Right? You're recognizing, okay, I'm falling into these patterns again.
Mm-hmm.
And then, get help somewhere, whether it's a support group, whether it's back to your surgeon, whether there's a therapist.
Mm-hmm.
I'm sure everybody here is from all over the place, so you can look into, where you live. I would definitely recommend seeing a therapist who specializes in either bariatric surgery or sometimes eating disorders. It depends. They need to also they need to understand bariatric surgery as well.
We were actually talking about that when we first got here, about how bariatric therapy is a different breed of therapy because you understand what we're going through, and that it is a lot of mental work that we have to do.
Yes.
Mm-hmm.
Yes, and there are some differences between someone who is exclusively an eating disorders provider and doesn't do a lot of the work with obesity or weight management or bariatric surgery. So it is important to find someone that will align with your goals.
Okay, that makes a lot of sense.
Mm-hmm.
Yeah, I think I'll be calling my office.
Yeah, and now with telehealth kind of rules are relaxing a little bit, even if you can maybe find someone who isn't close to you. There are differences in state laws depending on where people can practice. So there's a lot of kind of realities that your therapist, whoever you contact, should know about that.
Okay.
But also it's learning. Someone at one of the talks said it yesterday is to be comfortable with discomfort.
Yes.
Right? And
We're
that
really uncomfortable.
Yep.
Yeah.
exactly. Right? When you are craving food, think about what that feels like.
It's
Everybody for a
uncomfortable.
second, right? Think
Yeah.
about it. Whether you're feeling stress
Yeah.
or you're feeling a craving or whatever, you can learn how to ride that. You can validate yourself. I know I'm feeling this way. And this is an uncomfortable feeling. But feelings go away.
Well, I think before, like, I didn't like sitting in the uncomfortability. And what I've learned being 6 years post-op is that it's okay to feel your feelings.
Yes, 100%. We have discovered that doing this podcast, we
Yeah.
have learned that it's okay to feel our feelings. It's okay to cry, it's okay to be angry. All of those things are fine. It's what you do with those emotions that matter.
Yeah.
So if you're taking those emotions and giving yourself leeway to do whatever you want, whether that be, gambling, drugs, eating, and you're doing it to punish yourself almost, I feel like sometimes. Like you're eating, you know it's bad for you, but you're still doing it.
Right.
So.
Right. It's the hiding part of it.
Mm-hmm.
You know, it's the when you know you're doing it in abundance.
Mm-hmm.
It's almost like you could think about someone who doesn't have an addiction problem,
Mm-hmm.
okay? Breaks up with the boyfriend, gets a divorce, and wants to go out for a drink with a friend. Is there anything wrong with that?
No.
No. That's not a problem. You know, maybe they're drinking because of emotional reasons, but when is it a problem? When they start doing it every day, when they start doing it too much, when they start sneaking, lying, you know, all the criteria that we talked about before. And that could also be a slippery slope for surgery, and I'm curious to hear what people think about that, right?
Yeah.
Do you want to give yourself that, oh, you know, today I'm feeling sad, so it's okay to go out and get ice cream, and at what point are you going to say, okay, this could be a slippery slope?
Yeah, I feel like after my ex left me, I gave myself that leeway. I said, oh, it's okay. Your husband just left you, so it's okay to go eat cake.
Right.
It's okay. You can eat cake for breakfast, lunch, and dinner. It's fine. Your husband just left you. Like, I gave myself that leeway, but then as I went further and further and further, it was giving myself leeway to eat whatever I wanted.
Right.
So I
looking
definitely
back,
went through that.
do you think if you could do it all over, would you set like a time limit on it? Like, okay, you can do that today.
No, I would have said no. You're not. Like, go find something else to do. If I could go back, I would probably be like, I'm going to go on a walk instead, or because it is a slippery slope, and I have an all or nothing personality. So that's where I'm at with men. But
Well, all or nothing can be worked on too. Right? If you start catching those all or nothing thoughts, and you can start to say, I'm doing all or nothing thinking, catching it. Okay, it doesn't have to be this way.
and moving on from it.
Where
Not a
can
problem. Jesus.
Well, where can people find help, like from you?
So for me, so I'm in California, so it really depends on where people live, and I have databases that I can look. So if someone is in a different state and wants to work with me, you know, you guys can always contact me, and I can let you know if I can or can't.
Okay.
But I can also try to steer you in the direction of the state where you're at to try to find someone if I can.
Perfect. And she just finally got on Instagram. Like 2 days ago.
I was looking at everything for this retreat, and I was like, oh my god, look at this. This is amazing. So I just got on Instagram.
Everybody go follow her.
And this
What's your handle?
I don't even.
I think it's just
everybody behavioral health.
Yeah.
Oh yeah, and there's a flyer on your tables, and that's
Yes.
if you want to sign up for a program that I'm going to be launching sometime soon.
Yeah.
But yeah, and I mean, this conference is so great because I'm used to going to conferences where it's like so, you know, professional, and you guys are,
And then you got hooked up with us.
awesome.
Sure.
you know, because it's real.
Yeah,
you guys
it's
are
real.
real.
Yeah.
You know.
Well, thank you.
Yeah.
Well, we're gonna open it up for everybody that's here. We have a mic if anybody has any questions for Dr. Shapiro. So if you guys want to do that, this is your time.
Yeah.
Congratulations
Come on
to
up.
everybody for
Yeah.
doing this, for being here. You guys rock.
Any questions?
I have a question.
Okay.
So this may be like silly, but what's the difference between obsessing and craving? Like I know the difference, but I feel like do I obsess over cravings? Are they're two different things, right? Like obsessing over, like, let's say for example, I see a Pizza Hut commercial and then I'm like, I will keep thinking about the Pizza Hut. So is it really a craving, and can it turn into an obsession? Are they different? Are they the same? I know it sounds silly, I don't know.
No, it's not silly at all.
So
Yeah.
the question is, what's the difference between a craving
Yeah,
and
thanks.
an obsession?
And can a craving turn into an obsession?
So when I think of obsession, I think about thoughts
Okay.
in my head. When you think about cravings, what do you think about?
Well, for me, it's like, oh my god, that cheese pizza looks so good, but I'll keep thinking about it and thinking about it until I go get it, and then I go get it, and then I'm like satisfied. So am I obsessing over it? Was I craving over it, or was I both?
It sounds like it could be both.
Okay.
Yeah. I mean, maybe an obsession wouldn't be a craving in a situation where you're just thinking about what to eat all day long and you just can't get it out of your head. It's food in general. It's not a specific craving, but you're talking about one specific thing.
Okay.
And you know, with cravings there are strategies too, because sometimes you can get into the craving and be done with it. Other times you can ride the wave and the craving goes away.
But an obsession, you would continue
To think
about it even after you got whatever you were obsessing about.
Maybe.
Yeah.
Yeah, maybe it would go away, maybe it would come back tomorrow, but you know, the treatment for obsession in general is, it's kind of exposure. It's not giving into, when you have an obsession, how do you get rid of it? By giving into it. By giving into it, and then the obsession comes back, and it's just this whole feedback loop. So you have to kind of learn ways of stopping that.
Perfect. So I think the craving can turn into an obsession.
See some questions
Oh
over
yeah.
Yeah.
We'll get that table because I saw those hands first, and then we'll move over to the left.
Just to kind of pile on that, I definitely think it can be. I know that pre-op, I would have moments where I would obsess over which craving I wanted more. So I would crave, Chinese food, but then I also wanted seafood, and me and my husband would literally sit there for 2-3 hours while I debated in my head which one do I want more. And then I would decide and get one and then not feel satisfied because I was like, no, I still want that other one. So, I mean, I definitely think that it could be related.
I completely agree. Because I have a problem with, I like little bits of everything. So if I could go to a restaurant and be like, can I have 2 bites of everything on your menu, I would be happy.
Yeah.
So I do the same thing. I'll be like, chicken sounds really good, but so does steak. Oh, I could just have a piece of cake for dinner. Like,
It sounds like FOMO.
And that is what we need
I
to
do.
do. When we go somewhere, it's the same thing. It's like, okay, well, 5 different things on this menu sound good, and so I get a main meal, but then I get a side of this, and a side of that, and a side of this. And sometimes I finished all, sometimes I didn't, but as you can imagine, for 2 people, like, we oftentimes pay $80 at a restaurant that would normally cost 2 people maybe $30 because I ordered 5 or 6 sides because I couldn't decide which one I wanted.
So in an example like that, one thing that comes to mind for me is, and I use this with so many different examples, but to really think about the child situation and how you would talk to a child, right? Whether it's in the same food environment, or you can think about going to a toy store and they can't decide, so they've got like 5, 6, 7, however many toys in their basket, and they're sitting there and they don't know which one they want. I mean, are you gonna let them sit there for 2 hours and decide? Or are you gonna say, you know what, let's just take all of them since you can't make up your mind? You would think about, yeah, they all look fun, we can come back another day, but today we're gonna pick one. And if they still can't make up their mind, you can say, okay, well then I'm gonna pick for you.
Yeah, to kind of do that to yourself, it sounds like, to help out. Next question?
I have a question, Dr. Shapiro. You had said earlier that there haven't been specific foods identified that cause a chemical dependency. I recently read Food Junkies by Bariatric, and the kind of premise is that some of us are chemically addicted to sugar or wheat. Could you speak a little bit more about your perspective on that?
Yeah, I mean, I haven't read that book, so I can't really comment too much on that perspective, but the term is it an addiction, that's kind of where, if you can just stop eating it, are you able to? Can you just stop eating? And if you do start, then do you go right back into addiction mode? And are you physically able to have a little bit? Do we treat it like abstinence? Should you not have sugar? Because you have to think about it. Sugar, wheat, flour, like all these things, it's in so many
It's in everything.
foods.
Everything. Yeah. And sugar can be fine in small doses, but like they put sugar in ketchup.
Yeah.
Or Taco Bell puts honey in their tortillas. And it's an addicting flavor because you crave that sweetness. Even people that don't really like sweets, cake, things like that, but you're still getting sugar because you're having it in random products.
Yeah.
Barbecue sauce, ketchup, sauces especially.
Yeah, and you can know yourself and know, okay, I don't really do well with these foods, and maybe make the decision to not have them. And when it comes to bariatric surgery, your surgeons or your dietitians might say, that's better, just avoid those foods. And that's kind of why there's a difference sometimes between an eating disorder provider that doesn't work with bariatric surgery, because then they may not understand that you do need to restrict some of these foods, and then they may try to help you by incorporating these foods again, which can be very good for some people, right? Because we live in a world that has all of these foods, and we want to be able to navigate that if we can.
Yeah.
But for other people, it may turn into a problem.
So like you can incorporate foods in small doses and you're fine, for the most part.
For the most part, yeah.
Not so much for me.
Yeah, I don't know where that even comes from, but yeah, I can totally just have like little bits and be totally fine and move on and not have any issues. So.
Is that my all or nothing personality?
All right, Kate.
So for binging, there's always the shame cycle. Like you'll binge and the next year, like, I want to do better. Do you have any recommendations for people to kind of work through that so that they're not always hating on themselves?
Yeah, I mean, that's a really,
So the question is like, how do you stop hating yourself when you binge, right?
Yeah.
Okay.
I mean, can we bring up TikTok too? Like as if it was a kid example again, right? Like if it was a kid, right, you might punish the behavior but not the child, right? So like let's talk about what happened.
My therapist always ends every session with, be kind to yourself. Like, yeah.
Well, I mean, it's because you wouldn't talk to someone else like that. You wouldn't hate someone else, and you wouldn't tell a kid, I can't believe you did that. You are disgusting. You are not going to eat tomorrow. I mean, I'm embarrassed for you. You know what? You shouldn't even go out and look at people tonight, because they can probably tell that you did that today. Like these are things that I've heard people say, so thinking about, okay, if this was your kid at home that did that, what would you say to them?
Yeah, I think it's, going back to that is really good, because like as you say it, I'm like, oh, I say that sometimes.
Totally have done that.
Yeah.
Well, this was such a serious topic.
Yes, it was.
We're gonna have to like have some fun later. So thank you, Dr. Shapiro, for hanging out with us, doing this with us.